I'm a board-certified ER doctor, still practicing almost 25 years now, and I spent much of my early career in that industry, in the health system industry. And it's been interesting to kind of transition from then health payer to working for one of the big three in the health plan space to now a PBM. And what I've, over the time, kind of put together in my mind is these three different parts of the US healthcare system have incredible opportunities to integrate and work together for the patient's well-being that we have yet to see realized. So now being in the PBM industry and understanding that, you know, the patient doesn't really always understand that these different organizations sit in silos. So health systems operate in their island, the payers, the PBMs, employers are thinking about other things. So many of the barriers relate to the lack of information sharing that occurs between all of these entities with the patient in the center. So ultimately that creates a significant barrier for people to really assess the value of care. We always hear about value-based care. Well, it's difficult to understand what care is worth or if outcomes are great if we can't connect all of these different functions of what the healthcare system should do for the patient. The first step that CapitalRX took several years ago was an attempt to really think about how information is shared, exchanged, and made visible. And so the only way, in my mind, to do that is to really gut the system out and rebuild something new. So it's our mission and how we were founded to create a nimble, efficient way of looking end-to-end at a pharmacy claim through its journey. Once you do that, you can deliver what everybody wants is transparency, value, and also efficiency and reduce cost. The next iteration of that is really getting from pharmacy into the overall medical ecosystem so that you break down the barriers between the medical record keeping, the claim systems, and so on, so that you can show end-to-end what happens when a patient sees a doctor and what happens when that claim is generated and ultimately the doctors are paid in a seamless fashion. This is an uphill battle. This is not an easy task. The United States has a reactive healthcare system, not a proactive healthcare system. The pandemic was an illustration of that. The minute we had a crisis, our healthcare crisis affecting our economic system, within a year we can create an amazing vaccine, typically something isn't a major revenue generating business, and save the world in a very, very short period of time because we see the value. But that was a reactive process. It's not a proactive process. So if we start incentivizing our systems with financial rewards to promote outcomes, I think you'll see a significant change in how we think about data, how it's exchanged with all those different parties I talked about, and then doing what's best for the patient.